It's a great talk to follow, and thank you, Dr. Grasno. That was for your. Now, I'm going to talk about mobility improvements with lipedema reduction surgery. And so I'm calling it. Again, same disclosures. They haven't changed. I'm calling it lipedema reduction surgery because it's not. It's a reconstructive procedure. It's not a cosmetic procedure. And so it's a large volume surgery to debulk excess connective tissue, adipose tissue, and it does improve mechanics, mobility, alignment, flexion, and gait. And I'm gonna get into that. And so I don't want to call it liposuction. What I'm doing is lipedema reduction surgery. So it's a large volume. So the average aspirates on the thighs are over 6 liters, and then much less on calves and ankles. And if so, it can and then. In between on that, and some on very large patients. I removed as much as 13 liters. The average time, it's longer. So I have a whole routine where I map things out, and I use very small cannulas. I take a long time, and so. These are long procedures, and they're much longer than a cosmetic surgery. So I want to introduce this. This is a long arm goniometer, okay, right there, and then it's aligned with the femur and the fibula, and this is how you measure knee flexion. You see a physical therapist, orthopedist, they're going to measure, and you have anything going on with your knee or leg mobility, they're going to measure that with this device. And so this is a lipedema lady, and you can see she's got what I like to call lipedema lusciousness right here and here. And so that lusciousness or tissue is interfere. So right here, she's at less than 90 degrees. That's a problem. That's going to affect mobility. And then this is where the green arrow, and I don't know if the green shows up that well, but is where it should be. And so that's my. We follow this as part of our routine. We measure this on all our lipedema patients. So we're wanting to. The whole point is to. Validate these surgeries and validate how they are impacting and improving our patients with lipedema. And so this is just well-published stuff. There's certain degrees of flexion that you need in your knee to do certain activities. And obviously, if you have limited flexion, you're gonna have trouble getting in and out of cars, stair ascent or descent, actually. And so following the lipedema reduction surgery, we're seeing improvements in the knee flexion. And I have to correct that because we just looked at the data, and it's now up to 10 degrees. And then we're showing improvements in gait. Like 80% are improved after surgery. Have normal gait, and then the knee alignment. So I'm just going to go into the data a little more. So the average knee alignment, this is a valgus thing or knock knee, and they're at 6 degrees. And at 6 degrees, that kind of knee alignment is going to increase the stresses in the knee joint, and it's going to accelerate degeneration of the cartilage. Whereas a correction, now that's not a full correction to normal would be 0, but 3 degrees actually is much less likely to associated with premature degeneration of the knees. And then you see on average, my lipedema ladies are starting, so normal knee flexion would be 140 degrees. And their average lipedema patients starting at 115 or 116 degrees, and then it improves 10 degrees. And that's going to make a big difference in their mobility and ability to get around. So we're getting, so there's these are used in clinical research. These are patient-reported outcome measures, and these were developed by the NIH and RAND Corporation, and they're normalized to the U.S. population, and they're used in all. I mean, they're used. Obviously, I'm using them now to study lipedema. I think and then I think that's the first. But we can use it. It's used to study knee surgeries, also almost every disease. There's a promise thing for them, and so we can compare the results and the benefits of our procedures and the health of our population to others. So this is the SF36, and these are 8 different domains or components of health. So general health, pain, social functioning, emotional well-being, physical functioning, and all the patients start significantly below the population mean. And after surgery, some of them cross above the mean, but and some don't quite cross the mean, but they all improve significantly. And then this is just that same kind of just in a graph pattern to see that there's just a continuous in all the domains. There's an improvement in these domains of health. And then we looked at the composite mobility score, and this is done in orthopedic literature and stuff. So we see a 6-point improvement, which is a 16% improvement in the T-score, and that's so what is in the literature is 2 to 3 degrees is considered minimally clinically important difference, and so we're at a multiple of 2 to 3 times a minimally important difference, and that's 2 to 3 times what many knee surgeries are looking at. And again, the population mean is 50. So then, looking at individual promise questions in our lipedema patients, we see a 16% improvement in the ability to walk at a normal speed, 18% improvement in the ability to go up and down stairs, and an improvement in ability to get up from a chair. All these things, these are really important measures because these measures in the literature are like this walking speed correlates directly with rate of disability and even mortality. And so if when we have these improvements, this is going to keep someone from. This is the difference between being able to continue to work or becoming disabled. And even long term could affect their mortality. So this is big. I think important things to demonstrate. So let's compare this lipedema reduction surgery to a total knee arthroscopy or knee replacement. And the knee function, gait, alignment, all those things are about equal. So the improvements, we see that. The improvements in specific activities of daily living, like walking speed, stair ascent, and sit to stand, are also equivalent or slightly better. And again, these improvements are associated with mortality and disability. So, and they have similar improvements in global health and overall mortality. And please understand that, so a total knee replacement is the most commonly performed orthopedic procedure, and it is an expensive thing. $60,000 to $100,000. So they're getting a bargain covering lipedema reduction surgery. And then this is just, again, a little plug for the Lipedema World Alliance. And thank you so much for your attention.